Okay, I'm just waiting for the little bar to finish loading up here.
Okay.
Okay, we're live. Hi, my name is
Yay.
Annette Friesman, and I'm with Cobra Recovery Iowa. And with me today is Wendy, and we are going to talk about parent-child interactive therapy. So this is a new term for me, PCIT. So can you explain to us, Wendy, what that is?
Absolutely. So PCIT, parent-child interaction therapy, is used with kiddos and parents where you're seeing some problems with behaviors, refusals, non-compliance. You can really use it a lot with the kids who have ADHD. But anytime you have a bunch of kiddos or a kiddo that is struggling with behaviors in the home, behaviors in the school, this is really where you want to go. It is an evidence-based protocol. It's very regimented in terms of first we do this, and then we do this, and then we do this. And so it's really nice that way. Best practice, it's really good with that 2 to 7 age group. You know, those are the kiddos that it's really meant for. It works really well with kids who have maybe some attachment issues. So any child that's been through maybe a lot of trauma, foster care, adoption, things like that, where you're noticing some attachment issues, it's really effective with those kiddos. And we've kind of taken it out of the bounds occasionally with kids that maybe we see that are really struggling with some attachment concerns. And we have used parts of the protocol to help those kids who are struggling with attachment issues. So the really nice thing about PCIT is that me as a therapist, I am teaching the parent and giving the parent the skills to kind of treat their own child. The protocol starts with some real basic, these are the skills I teach. We call them the pride skills. And so these are the skills that when the parents first come in, I'm going to teach them these very specific skills. A lot of parents are doing a lot of these things, but what I tell parents is we're going to kind of bump it up on steroids. We're really going to push so that you are using these skills constantly and all the time with your kiddo. The other piece is that they're going to do what we call homework. And their homework is practicing these skills during playtime with their kid for 5 minutes every day. And so what we notice is those parents who are, you know, I do my homework every day and, you know, I do my homework 5 days a week. That would be like the gold standard to actually get it in. It's hard to find that 5 minutes every day to do something with your kiddo. But I tell them I want you to play with them. And so bouncing off that, they come to the office once a week. And that's where I'm working with the parents on some of the areas they're struggling with. And we're helping them to kind of direct their play so that they are teaching their child to be more compliant, encouraging their child to be more anxious to please them. I guess that's how we put it when we're explaining it. So the pride skills are praising, which most parents do anyway. But what we want to do is I want you to label it. So when you're praising your child, I want you to thank you for putting your dishes in the sink. Instead of saying thanks, just make sure you're labeling what it is, the behavior is that you like. One of the things that we know about kids is that their brains move a lot faster than ours. They're like, you know, they're running at, you know, 210 miles an hour. So if your rule is take your shoes off at the door and your kid comes in, they take their shoes off at the door and you say, hey, great job. And in reality, their brain is 3 steps ahead of you. And they're already seeing the toy that they're going to grab from their sibling on the other side of the room. So you're saying, hey, great job, thinking you took your shoes off at the door, when in reality, they're getting ready to yank a toy from a sibling, and that's where their brain is. So you're saying thanks, and they're subconsciously not making all that connection because their brains are working faster. So that's why we always say we want to label what it is that you like, because then they're more aware of, oh, mom liked I took my shoes off at the door. And so they know exactly what that behavior is that they were doing. Because otherwise, you know, it's 50-50. They're guessing as to whether or not they're what you're saying thanks for.
Right.
The other piece is, so that's the P in pride, praising. The next one is reflect. And so this is simply reflecting back to them what they've said. This is like, this is becoming a therapist 101. If your client says, I'm really tired today, you nod and say, oh, you're really tired today. So you're reflecting back. So if your kid says, this shoe doesn't fit right, then you say, oh, your shoe doesn't fit right. And you're noticing and you're giving value to the fact that what they said was important. Now, is it earth-shattering? No. But for them, my mom, my dad is really paying attention to me. They are noticing that I said my leg hurts today. And that's what they want. They want your, just even if it's, tiny bits and pieces, your kiddos want you to notice them as human beings, The I, imitate. This one is so funny because it basically means play with what they're playing. When they come in the playroom or you're doing special playtime with them at home, play with what they're playing. So many parents, the kids choose cars and mom's like, I don't want to play cars. Well, I'll sit here beside you while I, build with this Lego. And I was like, no, if they want to play cars, you play cars with them. That's how it works. And parents like, oh, okay. Yeah. So, do what they're doing. Describe the behavior. This one is really hard for parents because it feels really awkward. What you're doing is you're describing, you put the block on top of the tower, you put the car underneath the bridge. So it's describing what they're doing. I tell parents this is the sports commentating. So any of the parents that watch sports, he rounds third base, he rounds second base, just describe what they're doing. And then the E is just enjoy it. Enjoy time with your kids, spend that 5 minutes a day and have a good time. So, all right. So that's the
Pride. Yep.
That's the pride skills. PCIT is broken into 2 sections. The first part is what we call child-directed interaction. So they get to direct kind of what you're doing. Once you've mastered the pride skills and the child is, what we do every week is we do a score. So we have the parents do kind of this little evaluation score. And usually what we want to see is the trajectory is going down, that the behaviors are getting smaller, the outbursts are getting less frequent. So we're looking for, the severity and the intensity and the frequency of things and seeing if they're going down. And if they're going down, then we're going to slip into the second piece of PCIT, which becomes parent-directed interactions. Parents are always looking forward to this stage, but I always tell them that if we spend a lot of time on the first piece where you're practicing those pride skills and you're building that relationship, then the second piece, which is the discipline strategies, will go really quick. And they're like, oh, I need to get to those discipline strategies. I need to know how to discipline. But the reality of the world is if you don't build up that relationship first and you just come in really hard with discipline, your discipline is not going to be very effective. And it's not going to be the kind of discipline where you're building up trust and a relationship and things like that with your kiddos. So the discipline strategy is probably the shortest part of the whole protocol. I mean, I can spend, 3 months on CDI and we can be in and out of the discipline strategies in 4 to 6 weeks. So that's how effective spending time with your kiddo, playing with your kiddo, and just changing some of, it's basically a lot of times tweaking what you're talking, how you're talking to your child. Make sense?
It does. Yeah. So when someone would come into your office, are you working with both parent and child? Or are you just working with the parent?
No, when they come into my office, usually we'll do an intake session. We'll, discuss what are some of the underlying things, what's going on, what's our clinical concern. And if we have a lot of behavioral stuff, they're a little bit younger, I'm going to say, hey, we should do PCIT. And then in an actual session, what they do is they come in and I have a room with a one-way mirror and I am behind the one-way mirror and they're on the other side. And I have a nice room with some toys and a table and things to do. And they have an earbud and I have a microphone and I'm on the other side and I'm coaching them. So I'm going to say, hey, today you're going to work really hard on your praises. This is probably your lowest piece, and we're going to practice. And so they're going to start playing with their kiddo and using their pride skills. And so as they use their pride skills, I'll be like, oh, great labeled phrase. Oh, that's a good idea. That was a good reflection. Those are the sorts of things I'm going to do. So they are actually playing with their child during the session, and I'm coaching them. Yeah, it's the easiest thing as a therapist, because I just, make them do all the work.
But yet you're teaching them how to do it at home.
Yep, teaching them how to do it at home. Then they come in each week and we're practicing those skills. I'm giving them some ideas for, when you're at home, if you use these labeled phrases throughout your day, what you're going to notice is they're going to start to react to it and their behaviors will start getting better. Hey, Mom, did you notice I put my coat on the hook? I did notice you put your coat on the hook. Really good job doing that. And so with the therapy, what I'm doing is also I'm coaching them, and also I'm giving them pointers throughout about, okay, so bedtimes are really hard. So let's think about how we can change what you're saying at bedtime to make it more effective using our pride skills.
So COVID recovery Iowa, we cover the whole state of Iowa.
Yep.
You're in Northeast Iowa. So how does someone find or go about getting access to this type of therapy?
Okay. In Iowa, the University of Iowa has a database. I'm not sure, but they have a list. So if you go to University of Iowa and look up PCIT, they can connect you up with a list of people who have completed the treatment training for PCIT. Beth Troutman is the kind of the go-to trainer in Iowa, but she maintains a list of people that are doing PCIT.
And she's with the University of Iowa.
She's with the University of Iowa. Yep. And if you just look up PCIT University of Iowa, you should get right to that that site. I probably should have looked it up. We probably could look it up and
we can add it to the comments later.
Okay, great.
We can do that. How does insurance pay for this?
Yeah, most insurance cover it the same as they'll cover individual therapy. And actually, insurance kind of likes it because it is one of those evidence-based protocols that you can, because we are evaluating every session, they can see progress or lack of progress. So.
Awesome. So you said it was for ages 2 to 7 usually. Is there any other ages, or do you sometimes go older, younger, or? Usually
younger is really, usually skill wise, younger is really not very viable, but older is definitely, we're sometimes limited by when you get to the discipline strategies, you need to be able to have the parent move the child to a timeout and within the session. And so beyond age 7, some of those kids, get a little, I can't get you into a chair for a timeout. Right. And so we don't ever want to have anybody not being safe. That being said, as long as you're leaving out some of the timeout strategies and stuff that you get into with the discipline, you can use it much older, actually. And I've used it with, I have a 14-year-old that we've been using the attachment piece on, using the pride skills on. The intention never was to do any discipline strategies with them, but we've had some really nice success with building that attachment with the parent using PCIT, even with a 14-year-old.
So there's skills that you can use beyond.
There's skills you can absolutely use beyond age 7. So, and I've had some parents that their skills are pretty decent, but I'm like, you know what, let me do some training, do a couple of sessions. We're not going to complete the whole protocol, but let's give you some of the language and some of the skills. And so I've done that before.
Awesome. All right. Anything else you want to tell us about PCIT? I think we've got to be close to our 15 minutes here.
Yeah, we are about that. No, it's just really effective. Sometimes some of the pieces look a little awkward for parents and you're like, well, how is this going to help? But I've had some amazing success. And the only reason I have parents that maybe don't have success with it is if they're just not following through. So those parents that are coming in and doing it, I've just got a list of parents like, this is the best thing ever. This is so awesome. And it's parents just learning new skills. It's fantastic.
And doing their homework. Okay, thank you, Wendy. We will put, we'll look up that link to that to
Okay.
University of Iowa. If you, and we can put it in there. You can send it to me or Mandy, or put it in the comment yourself is fine.
Okay.
We'll get that in there. If anyone, I don't see any questions or anything from anybody. So if anyone has any questions later, put them in the chat box or the comment section, and we'll get back to them. So thank you for joining us, Wendy.
Thank you. Bye-bye.
Bye.